He spotted the symptoms before anyone else. While passengers panicked and called 911, the bus driver was already performing advanced life support procedures. His movements weren't random. His knowledge wasn't basic first aid. And when paramedics arrived, they realized Marcus Williams had been saving lives longer than most of them had been medics. Comment what city you're watching from below. And if you believe people working the most ordinary jobs sometimes have the most extraordinary skills, hit subscribe. Because what you'll learn in this story will show you that the quiet person sitting next to you might have training that could save your life. Marcus Williams was 38 years old, 5 feet 9 inches tall, African American, and one of the most reliable drivers for Detroit city buses. He'd been working Route 47 for 7 years, starting his shift at 6:30 a.m. every morning, completing 12 trips daily on the route from downtown to the suburbs, and finishing his shift at 6 p.m. Passengers saw him only as the driver. Colleagues simply called him Marcus. To management, he was an on-time, trouble-free, dependable employee. Who Marcus was, what he'd done before, what experiences he'd lived through, none of it was anyone's concern. Detroit city buses had become the perfect hiding place for Marcus: predictable routes, minimal personal interaction, anonymity. Every day he picked up the same passengers at the same stops, managed the same traffic, followed the same routine. But Marcus's habits contained details that careful eyes might notice. In his bag, alongside standard driver equipment, he carried strange items: advanced first aid kit, oxygen masks, emergency medical supplies. During his breaks, Marcus knew by heart every hospital, emergency room, and medical center along his bus route. Which hospitals had which specialists, locations of the nearest trauma centers, ambulance response times, he knew them all. Most importantly, Marcus's eyes. Not normal driver eyes, but eyes trained to constantly perform health assessments. Eyes that evaluated passengers not just as people to transport, but as potential patients. That Tuesday morning started like any other on Route 47. Marcus picked up his bus from the terminal depot at 6:30 and headed out for his first run. The 45-minute route from downtown Detroit to the suburban Heights area. Morning passengers were always the same: office workers heading to jobs, elderly people going to hospitals, students heading to school. Marcus knew them all, having traveled the same hours with most of them for years. At the third stop, Harold Peterson boarded. 67 years old, a retired accountant, he used the bus 3 times a week to go to physical therapy. Marcus had known him for 4 years. Harold sat in his usual seat right behind the driver. He greeted Marcus as always, mentioning it was physical therapy day and complaining about his knee that wouldn't heal. Marcus observed Harold in the rearview mirror. Something was different. Harold's complexion was paler than usual, his breathing more shallow, his sitting position more tense. After the 5th stop, traffic intensified. Marcus kept his attention on the road while continuing to monitor Harold. The man had started sweating. On a cold November morning, in a heated bus, he was sweating. Marcus's training began sounding alarms. This combination of symptoms was a sign that something was going wrong. When Marcus asked how he was feeling, Harold said he was fine, just a little tired. But Marcus noticed the tension in Harold's voice. He was getting short of breath while speaking. Before the 7th stop, Harold suddenly leaned forward, clutched his chest, and shouted, "Marcus!" In panic, Marcus immediately pulled the bus over. Harold was holding his chest, his face had turned gray, he couldn't breathe. Classic myocardial infarction symptoms, heart attack. After safely pulling over and setting the parking brake, Marcus immediately went to Harold's side. While other passengers were starting to panic, trying to understand what was happening, Marcus took control. He told everyone to stay calm in a voice that automatically carried command authority, instructing someone to call 911 and report a heart attack. Marcus knelt beside Harold. Pulse check, pupil response, respiratory assessment. His movements were too fast, too precise, too professional. Harold's pulse was weak and irregular. Skin color changes had begun, symptoms that were harbingers of cardiac arrest. The equipment Marcus pulled from his bag surprised the other passengers. Professional oxygen mask, automated external defibrillator AED, advanced medical instruments. These weren't normal driver equipment. Marcus asked Harold how long he'd been having chest pain, getting an answer of about 10 minutes. He positioned Harold properly on the bus floor, applying the ABC protocol perfectly: airway, breathing, circulation. While someone checked on the ambulance location, Marcus continued his intervention without hesitation. Harold's condition was deteriorating. Loss of consciousness was beginning. Marcus pulled out the AED and placed electrodes on Harold's chest. The device began analyzing heart rhythm, then advised shock. With military precision, Marcus commanded everyone to stand back. The electric shock was administered. Harold's body convulsed. Marcus immediately began CPR. 30 compressions, 2 breaths. 30 compressions, 2 breaths. The rhythm and depth were perfect. Passengers on the bus watched in horror. Marcus's movements were unlike anything they'd ever seen. This wasn't amateur first aid. This was professional combat medicine. After the second shock was administered, Harold's pulse returned. Weak but regular. His breathing stabilized. Marcus continued monitoring Harold's vital signs, telling him to stay with him as the ambulance was coming. Just then, the paramedics arrived. When the paramedic team entered the bus, they were surprised to see the work Marcus had done. Harold was under professional medical care. Lead paramedic Sarah Martinez immediately assessed the situation, asking who had performed these interventions. When Marcus said he had done it, Sarah examined Harold's condition. Fourth line was properly placed, oxygen flow was at optimal levels, EKG monitoring was active, medication administration records were kept. Sarah asked who Marcus was and how he knew these procedures. When Marcus simply said he was a bus driver, Sarah insisted this was advanced life support and that he had medical training. Marcus hesitated. The truth he'd hidden for 7 years no longer made sense to conceal. He revealed he was a former Army combat medic with 12 years of active duty. When Sarah asked which unit, Marcus answered 3rd Infantry Division, Iraq and Afghanistan. Sarah's partner Mike noted that the quality of interventions was hospital level, wondering if combat medic training was that advanced. Marcus explained they worked at forward operating bases where they were the nearest medical personnel when there wasn't a doctor, so they learned to do everything. Sarah performed a final check on Harold's condition, telling Marcus he had saved the man's life. When they arrived, Harold was stable because Marcus had performed perfect intervention. Marcus insisted he had just done what needed to be done, but Sarah emphasized he had done much more. This level of intervention was difficult even in hospitals. As Harold was transported to the hospital, Sarah asked Marcus why he worked as a bus driver with these skills. Marcus looked at the other passengers on his bus, all watching him with different eyes. He was no longer just a driver. He was someone who saved lives. He explained that he could serve people here too, just in a different way. After Harold was taken to the hospital, questions began pouring in for Marcus. Bus passengers, transportation company managers, local media. Everyone wanted to know who Marcus Williams really was. Marcus was speaking with his supervisor at the Detroit Transit Authority office. The supervisor noted they'd worked together for 7 years, but Marcus had never mentioned his military background, saying he didn't think it was important since he was just a bus driver. When pressed about his skills and training, Marcus took a deep breath and explained he was a combat medic who worked at forward operating bases, taking care of wounded soldiers after IED explosions and combat injuries until medevac helicopters arrived. When asked about the duration of his service, Marcus revealed 12 years active duty with 3 deployments, 4 years in Iraq, 5 years in Afghanistan. His supervisor's expression turned to respect, asking why Marcus wasn't working in the medical field with this experience. Marcus looked out at Detroit's streets, explaining that war and peace were different things. There, he made life or death decisions every day, but here, he safely transported people from point A to point B with less stress and trauma. When his supervisor mentioned his abilities, Marcus said he used them that day and would when necessary, but didn't have to experience emergency situations every day. That evening, Harold Peterson's family called Marcus. Harold was alive, in stable condition, heading toward complete recovery. Harold's daughter expressed that Marcus had saved her father's life, and they didn't know how to thank him. Marcus insisted no thanks were necessary, that he had just done his job. But she emphasized he had done much more, Doctors said without his intervention, her father wouldn't have made it to the hospital. After the story appeared in local news, Marcus's life changed. Detroit residents no longer saw him as just the Route 47 driver. He was a life-saving hero. But Marcus wasn't pleased with this attention. He told Detroit Transit Authority he just wanted to do his normal job, but was told he was no longer a normal driver. He was a community hero. Marcus responded that heroes wear medals and get recognition, while he just tried to transport people. But changes were inevitable. Marcus received offers to train city bus drivers in emergency response. His supervisor encouraged him to share his experience and train other drivers. Marcus accepted, but only on weekends. 2 days a week training, other days his normal route. Detroit Fire Department also called, asking if he'd like to be a guest instructor in EMT training programs. The fire chief pointed out how few people in the city had his field experience, and sharing that experience would serve the community. Marcus accepted this too, but again part-time, emphasizing he was still a Route 47 driver, and that was his main job. 6 months after the incident, Marcus Williams was still working as a Route 47 driver for Detroit Transit Authority. But he was much more than that now. Every weekend, he provided basic emergency response training to Detroit City bus drivers, heart attack symptoms, CPR, AED use, emergency communication. He told them the most important thing was not to panic and let training take over. He also worked as a guest instructor at Detroit Fire Department EMT courses, sharing experiences from combat zones with young paramedics. He explained to them that civilian emergencies were different from combat, but basic principles were the same. ABC protocol, rapid assessment, decisive action. Harold Peterson, after recovering, had formed a special bond with Marcus. He continued using Route 47 every week, but now not just as a passenger, but as a friend. Harold told Marcus that what he did that morning didn't just save his life, but gave him a second chance. Marcus insisted he had just done what he could, but Harold emphasized that he had done much more and was now doing the same for other people. Marcus continued working on Route 47 every day, but no longer just as a driver. Today, Marcus Williams still works as a Route 47 driver for Detroit Transit Authority. Still the same route, with the same passengers, with the same dedication. But he no longer hides his identity. A small photo hangs on his bus dashboard, Marcus in his Army combat medic uniform. Below it, a plaque. Service continues in different forms. Every weekend, new trainees come to Marcus's emergency response training program. From city bus drivers to EMTs, everyone learning life-saving techniques he learned in the Army. The most important lesson, Marcus tells them, is that every civilian is a potential patient. Every trip could be a life-saving opportunity. And on Route 47, Marcus continues serving passengers every day, no longer to hide, because sometimes the greatest service is showing exactly who you are and using that identity to protect others. Harold Peterson's heart attack no longer frightens Marcus because that day reminded him of his true mission, being ready every day, every trip. And Marcus Williams, former Army combat medic, current Route 47 driver, and healer forever, is exactly where he needs to be. Subscribe to Silent Warriors, because your bus driver, store cashier, or security guard might have life-saving training. And maybe that calm person you encounter in daily life once learned to save lives in the most difficult situations. Show them respect. Because real heroes don't always wear uniforms. Sometimes they just wear driver badges and continue serving quietly.